Hi, I'm Dr. Xu. I'm a pain physician at Iowa Clinic. Here we're going to talk about the process of pain treatment. Typically, when the pain starts, we usually treat ourselves first with over-the-counter medications, cream and patch. And after 4 weeks, usually we say 4 weeks, if after self-care there's no significant improvement of the pain symptoms, then this is the time point probably we'll recommend the patient to see a primary care provider. And at that time, the primary care provider will have a more detailed exam and possibly try some prescription medications, physical therapy, or some diagnostic testings, including a medical imaging test. If after 6 to 8 weeks, the pain symptom remains to be persistent without significant improvement, and this is the time we will recommend patient to consider to see a pain specialist. And with pain specialists, we'll have more multimodal treatment options, including medications with different combination of different groups of medications, and some interventional treatment, including epidural steam injections or radiofrequency ablation for the arthritis pain, or there's some more advanced treatments such as neuromodulation for refractory chronic pain. Neuropathic pain is a main type of chronic pain. The neuropathic pain typically not only occurs in the axial back or axial neck, which means not only located in the back or neck, but also transfer to the limb, means the pain will go to the leg or goes to the arm, and the pain sensation is slightly different. The pain can be burning pain associated with numbness, tingling, buzzing, or sometimes has even weakness. Versus the muscle pain or joint pain, they are more tend to focal in the back or in the neck, and these pain tends to be more chronic, dull, aching pain. So these are different types of pain, and we use a different treatment. MRI imaging test, that's an advanced imaging test. It will show us a more detailed, especially the connective tissue or soft tissue, including the spinal cord, the nerve coming out of the spinal cord. Of course, in addition, there's a ligament. It's also very well visualized with MRI. So the MRI can give us very detailed information regarding the spine conditions. In pain conditions, there are some pain sends out we call the red flag or a little bit more urgent signals, which we recommend patient to seek primary care sooner than later. Some conditions including profound weakness in the limbs, in the legs, arms, feels numbness, tingling in the private part, or there's some incontinence with bowel movement or bladder movement, or there's a fevers or chills, or even weight loss associated with chronic pain. So these are conditions can potentially link to some more urgent conditions, and for that we will recommend patient to seek medical care sooner than later. These red flag conditions can associate with what we call the compression of the spinal cord. It also can cause by pain associated with metastatic cancer or infection of the spine. So these are conditions we want to get treated sooner than later. If your pain condition has been prolonged and interfere your daily activities, and you have tried some treatment which is still refractory, I will recommend patient to reach out to primary care provider or get connected with Iowa Clinic and get scheduled with pain management department. Again, our goal is to make you more feel like yourself and to decrease the pain and also to increase your quality of life.